Hello, my name is Lam Tong. Today I will be presenting Family Management Style Framework. First, I would like to give you an overview about the presentation. I will be discussing about the description of Family Management Style Framework, the key concept of the framework, important definitions, analysis of how the framework applies to family care, and the discussion of the two research projects guided by the framework, and the conclusion. The Family Management Style Framework was established or developed in 1990 by Neffel and Dietrich and revised in 2003. It is a conceptual representation of how family responds to a child condition that incorporates the views of individual family members to the overall family response. This assessment instrument helps nurses understand the needs of the families who have children with specific chronic conditions, children undergoing palliative care at home, and adolescents who have spina bifida. By understanding the family responses to the chronic conditions, help provides ways for the family nurses to offer effective interventions to meet both the needs of the child and the family. Next, we are going to discuss about the key concept of the framework. Excuse me. In this framework, there are 5 family management styles, consist of thriving, accommodating, enduring, struggling, and floundering. The management styles a family adopt is based on how the family define the situation, manage the situation, and perceive the consequences of the situation. In this framework, parents each define what the chronic condition means for them individually and their family. It also includes how the parent views the child. For instance, does the parent view the child as a child who has health issue that can be managed, or does the parent focus on the condition before the child see the management of the health condition as tragic and difficult to manage? Their definitions often influenced by their beliefs about the condition cause, the seriousness and predictability in the course of the condition. Another component in defining the illness is how the similar of the two parents' perception are and how they view their child, the condition, parenting philosophy, and overall approach to management. Managing the child's condition is another piece to the establishing the family management style. One management approach may be that the parents are being confident in their ability to parent and manage the chronic health condition. Second approach is the burdensome, and the third is when the parents feel they are inadequate in their abilities to parent a child with chronic condition. Another aspect of the management concentrates on how the parents balances their ability to manage the chronic health condition with other parts of their life. Finally, another determinant of family management style consists of how the parents perceive the consequences of a chronic illness. It could be viewed as a central feature of a family, an organizing focus, or a life aspect balanced with responsibilities. The definitions of family consist of parents, child, siblings, caregivers, and extended family members. The health is defined as a chronic disease or a condition that a child or an individual of the family member experiencing, and how the family view the condition. The environment consists of homes, clinics, hospitals, community settings such as schools, and nursing, using the framework to understand the family management style to identify the needs to develop appropriate and effective interventions. Next, we're going to be discussing about the applications of the family management style framework. The family management style framework is applied to family nursing practice by being useful guide for a complete understanding of family life in the context of child chronic condition. It directs researchers and clinicians to assess the family response to a child chronic condition, especially with regard to how the condition management is incorporated in everyday family life. It helps identify the important aspects of the family definition of the situation, management behaviors, and perceived consequences that shape the management efforts. According to a study by Bosso et al. In 2012 that held in Brazil, with the purpose to explore the experience of family management with the context of palliative care and to assess the usefulness of the family management style framework in this new cultural and family context. The result of the study revealed that the situation or context of having a son or a daughter receiving the palliative care at home was defined as the family struggling to keep a balance because they needed to develop the necessary skills to manage the new situation in their daily life. The study also stated that the family's management style changed over time as the child clinical condition changed, and the family members had to acquire more information and skills for managing the child's palliative care at home. The study supported the usefulness of family management style framework for specifying unique areas of family strength and difficulty in the management of the child in palliative care at home. Next, we're going to be discussing about the research projects that was guided by the framework. The first study that we're going to be discussing is the study by Park et al. In 2019, with the purpose was to use an adapted version of the family management style framework to identify and describe the patterns of family management in parental advanced cancer. It was a qualitative study, in-depth interviews about the experiences of the parent with advanced cancer and a completed measures of psychosocial functioning using the family management style framework. The result of the studies shows that they identified 5 distinct patterns of family management in the parental advanced cancer. 1, equipped and optimistic. 2, equipped, pragmatic. 3, discouraged and struggling. 4, apprehensive and passive. And 5, discouraged and conflicted. The next study that we're going to be discussing about is Jacera et al. In 2020, with the purpose to know the family management experience of children with the sickle cell disease using family management style framework. The methods of the study was a qualitative case study. It was a semi-structured interviews. The study's result shows there are 3 management styles identified. 5 families in the accommodating style, 2 families in struggling style, and only 1 family in enduring style. It was noted that empowerment was having the skills and abilities to care for these children. Final conclusion of the study stated the family management knowledge of the children with sickle cell disease provided a reflection of the nurse's role in supporting, orienting, and encouraging the empowerment of these families, aiming at the search for comprehensive care. In conclusion, family management style framework is useful for differentiating and understanding underlying patterns of family response to family with children that has chronic and terminal illnesses as well as adults. It helps clinicians to identify the family needs and to provide effective interventions. This model is used for my family assessment assignment because my family has a child with disabilities that have put the family in constraint in many aspects. This is the references for my presentation, and thank you.